Hello guys, this is Indian Medico, and in this video we are going to see about changes in uterus and cervix prior to labor. First, let us see about the changes in uterus prior to labor. During pregnancy, the uterus narrows continuously to accommodate the products of conception. The blood flow of uterus is increased during pregnancy. The uterine musculature remains refractory to any stimuli till 36 to 38 weeks of gestation. That is, the pregnant uterus is in a state of quiescence till 36 to 38 weeks of gestation. Before onset of labor, the unresponsiveness of uterus is suspended. This is due to changes in expression of key proteins like contraction associated proteins. The contraction associated proteins are abbreviated as CAPs, and these include oxytocin receptors and PGF receptors. Before onset of labor, there will be marked increase in oxytocin receptors in uterus. There will also be increase in gap junction proteins in the uterus. All these will end the refractoriness of myometrium, and there will be effective uterine contractions. The myometrium contracts and retracts, that is, the fibers shorten when they contract, but they don't return to original length after relaxation. This causes fetal propulsion through the birth canal. Now, another important change prior to the onset of labor is the formation of lower uterine segment. The lower uterine segment develops from the isthmus of cervix. The isthmus of cervix is the part of uterine wall between anatomical and histological internal os. As pregnancy advances, the lower uterine segment stretches and thins out. This picture shows the isthmus of cervix during 10 weeks of gestation. As you can see, the isthmus of cervix is the part between the anatomical internal os and the histological internal os. This picture shows the isthmus of cervix during 16th week of gestation. Now, this picture shows the lower uterine segment during the third trimester of pregnancy. As you can see, the lower uterine segment has developed from the isthmus of cervix, which corresponds to the part between anatomical internal os and histological internal os. Now, let us see about the changes in cervix prior to labor. During pregnancy, the cervix becomes soft and it remains closed with a mucus plug. What is the purpose of this mucus plug? The purpose of this mucus plug is to prevent infection and to maintain the physical integrity of the uterus. Now, prior to labor, a process called ripening takes place in the cervix. The cervix softens further, it becomes shorter and thinner. This process of shortening and thinning of cervix is called effacement. The cervix becomes dilatable, that is, it responds to myometrial contraction and dilates to allow the passage of fetus. All these changes lead to the formation of a ripe cervix, that is, the cervix is now ready to go into labor. In case of primigravida, there will be effacement first, followed by cervical dilatation, whereas in multigravida, both effacement and cervical dilatation occur simultaneously during labor. After these changes in the uterus and cervix, there will be onset of labor. After the onset of labor, there will be progressive increase in frequency and intensity of the uterine contractions. There will be cervical dilatation and expulsion of fetus. If you have any suggestions, please let me know in the comment section. If you like this video, please like, share, subscribe and tell your friends about this channel. For more such videos, please check out my playlists. Thank you.